Everything you want to know about arrhythmia. An arrhythmia is a disorder of the heart that affects the rate or rhythm at which the heart beats, basically the way the electricity works. Too fast, tachycardia. Too slow, bradycardia. Too early, premature contraction. Too erratically, fibrillation. Arrhythmia versus dysrhythmia. Dysrhythmia is another name for arrhythmia. Arrhythmias are named and categorized based on three factors. Rate, whether it's too slow or too fast. Origin, whether it's in the ventricles or the atria. Regularity. Bradycardia. Bradycardia occurs when your heart rate slows to under 60 beats per minute. Heart block. Sick sinus syndrome. Sinus arrhythmia is one type of sick sinus syndrome, a group of disorders related to the sinus node. Tachycardias. Tachycardia occurs when your heart rate speeds up to more than 100 beats per minute. This rapid heartbeat can affect the way your heart pumps blood. Typically, if this condition lasts only a few minutes, it may not be serious. Ventricular arrhythmias. Ventricular arrhythmias begins in the ventricles, or the lower chambers, of the heart. Ventricular tachycardia. Ventricular fibrillation. Premature ventricular beats, PVCs, which are extra heartbeats that begin in the ventricles. Ventricular tachycardia. Ventricular tachycardia, VT, typically occurs in people who have had heart disease or heart-related issues, like coronary artery disease or a prior heart attack, but can occur in those with structurally normal hearts. Ventricular fibrillation. Ventricular fibrillation, VF, involves sudden, rapid, irregular, and chaotic heartbeats in the ventricle. Supraventricular arrhythmias, or atrial arrhythmias. Supraventricular tachycardia, SVT, includes different forms of arrhythmias that begin above the ventricles. Atrial fibrillation. If you have atrial fibrillation, also known as AF or AFib, your atria beat very rapidly, as fast as 400 beats per minute. The atria move so quickly that they aren't able to contract completely. Atrial flutter. In atrial flutter, AFL, the heart beats more rhythmic and constant than in atrial fibrillation. Premature heartbeat. A premature heartbeat can also sometimes lead to arrhythmia if you have another heart condition. Premature heartbeats feel like your heart has skipped a beat. Sinus arrhythmia. Scarring near the sinus node from heart disease or a heart attack may slow down or block the electrical impulses as they travel through the heart. You may not have any symptoms of an arrhythmia. Feeling like your heart skipped a beat. A fluttering feeling in your neck or chest. Rapid heartbeat. Slow or irregular heartbeat. Chest pain or tightness. Difficulty breathing. Irregular pulse. Weakness. Dizziness or lightheadedness. Fainting, or almost fainting. Fatigue. Sweating. Heart palpitations. Low blood pressure. Seek medical care right away if you experience any of these symptoms. What does arrhythmia feel like? Sometimes, arrhythmia is asymptomatic. You may not feel anything at all. Other physical or lifestyle factors can also cause arrhythmia in some cases. With our AFib newsletter, you'll get the latest information about your condition, treatments that are available, and tips on living a full life with AFib. Street drugs, particularly cocaine or amphetamines. ECG. Heart monitors. Medication. A doctor may give you medication to help you manage your arrhythmia and prevent complications like a heart attack. Calcium channel blockers, which can include amlodipine, Norvasc, and diltiazem, cardizem CD, help lower your blood pressure and heart rate. Surgery. Home remedies for arrhythmia. Arrhythmia triggers that can be prevented may include: develop a plan with your doctor to help manage your arrhythmia, including steps you can take when you have symptoms. However, some types of arrhythmias can be severe and require medical attention.